Hey there, I'm Sarah Zarella, a portrait and wedding photographer and your host for Wedding Secrets Unveiled. This is a podcast where we cut through the complexity of wedding planning, leaving you with everything you need to know directly from the industry experts. If you want to simplify your wedding planning while having fun, of course, you came to the right place. Join me while I guide you through your planning, starting from your engagement to your big day when you say, I do. After photographing for over 20 years, I am sharing with you tips and tricks to cut through the excess noise. Because I believe from the moment you said yes, your planning experience should be a magical time in your life. Here you'll find episodes that are fun, stress-free, and straight to the point with a fresh, honest take on the reality of what you really need to know about planning your perfect day. Let's dive in. Well, welcome back to Wedding Secrets Unveiled podcast, friends. So today's episode is a unique one. We are joined today with Dr. Naomi Goldman. She is a dentist in the Massachusetts area with over 10 years of experience. And today's podcast is really for anyone, wherever you live nationwide. If you are interested in learning about how to have a perfect smile, a white smile, and also how to help your smile be the best it can be before your big day, or whether you are planning to be in a wedding or you are getting married, this really is a podcast episode for you. I actually personally found it very interesting, and you'll see I asked a lot of questions that I wanted to know, so hopefully you wanted to know. So with that said, if you are looking into learning a little bit about whitening your teeth or any type of cosmetic procedures to make you have a better smile, this is definitely the episode for you. Welcome back to Wedding Secrets Unveiled podcast, friends. I'm your host, Sarah Zarella, and today I am joined with Dr. Goldman. Well, hello.
Hello.
Thank you so much for joining us. This is a new, fresh topic over here for all of our listeners. We have never had anybody with your expertise, so there's going to be a lot of learning today.
Yeah, I'm excited to share it all with you.
With that said, Dr. Goldman, can you tell our listeners a little bit about who you are, who you serve, and what you do in your business?
Sure. I'm a general and cosmetic dentist in Peabody, Massachusetts, so just in the North Shore of Boston. And we really like to focus on creating an awesome patient experience for our patients. We've kind of revamped the whole office to create a spa-like atmosphere as much as possible. I know there's so much dental anxiety out there, and we just wanted to make patients feel super comfortable when they come into our office. Another thing we really focus on is patient education and prevention. So kind of just taking a more comprehensive approach to dentistry and trying to find problems before they become big problems. So we have a 3D scanner. We have a couple 3D scanners in our office, and it basically not only identifies problems, but it tracks change over time. So we look at things and we can overlay these digital models of your teeth, and we can see changes over time, and we can see problems that have started to arise that we may want to address as they're, arising, rather than when they become a bigger issue. So we do a lot of prevention that way, and we also do a lot of cosmetic dentistry. I have built my practice from just advertising on Instagram. And most of the patients that come to see me from Instagram are like 25 to 45-year-old women. Like, that's my target. That's the people I love treating the most, probably because I can relate to them really well. Not to say that I don't have men that come in, or women that are older or younger than that, but the majority, I would say, are in that range. And I just love treating them. And I have a lot of people that come in before their weddings and want to improve their smile before their wedding. But it's really everything, all the cosmetics. And I don't limit that to just the women of 25 to 45. I have women and men that are doing Invisalign in their 70s. So.
Well, perfect. Well, that's why you're here, right? Because your target audience is our listeners. So with that said, for all of those who are listening, you are either going to be in a wedding, or you're going to be getting married, or you just want to put your best smile forward. So this is why we're here talking with you today about how to prep for the best smile, right? I mean, it's perfect. A photographer and a dentist. Here we go, right? So let's talk a little bit about just the basics. I mean, you kind of touched upon it with your expertise, but I would assume that let's just talk about not cosmetic, right? Just visual, the smile. How can someone elevate their smile? What are some tactics and procedures or, for lack of better terms, just things that they can do to help their smile be the best they can be for their wedding day, or if they're going to be in wedding photos?
Okay, so with the at-home products, the thing that everybody is doing wrong is that they're starting to whiten. They put a crest white strip on and their teeth start to lighten. And then they go and they drink coffee the next day. And what happens with your teeth is when you start whitening, they become more porous. So they will absorb stain faster than they normally would. And they also absorb whitening better as you progress through the days. So what's really important is to do the whitening day after day and to not eat or drink staining foods while you're doing that, which is very hard for people to do. Most people can't go a week without coffee. So for the majority of people, I just recommend doing it in office treatment. It's you do it and then you have to avoid staining foods and drinks for 12 to 24 hours and then you're done. And it's also just a lot faster because the strength of the gel is much higher than what you're using with an at-home product. Most of the time they have to protect your gums because the gel can burn your gums, and the at-home products are just so low that it's not an issue. So yes, they work, but you have to be super consistent and you have to avoid staining foods and drinks while you do it if you're going to use an at-home product.
A couple of questions on that for you.
Yeah.
That's very interesting because anyway, I just love your answer and thank you for addressing that because I feel like that's like the number one question right now that's out there. With that said, if you were using a whitening toothpaste, is that kind of the same thing? That kind of goes like you're exposing your teeth to stain? No, totally. We're just talking about the whitening strips. Okay.
Yes. So the reason why it's different is I think there's a few whitening toothpaste that actually have peroxide in them. I think the Colgate whitening one actually has peroxide in it, which is the active ingredient in whitening agents. But most whitening toothpastes do not. They are they're not actually whitening the inside of your teeth. All that they are doing is they're removing surface stain with an abrasive material.
So unless you were using the Colgate one that has the peroxide, we're not talking about the same thing. But if you are using that, we are kind of talking about the same type of
thing. I don't know how much it matters because the percentage in that Colgate toothpaste is so low. It's like even so much lower than a Crest White Strip. So it does have some active ingredient. I wouldn't necessarily just try and use that to whiten your teeth because it's such a low percentage of bleach. I would just, if you want to use that as your toothpaste, great. You might notice like a slight whitening effect, but I wouldn't try and use that as like a real whitening treatment because it's just too low of a percentage. You're not going to see big results with it. So hopefully that clarifies. So whitening toothpastes, generally they're working by removing surface stains, which some people do have a lot of surface stain and they will notice a big difference when they use the whitening toothpaste. Another little tip with that is you can dilute some hydrogen peroxide and dip some floss in the hydrogen peroxide and floss your teeth. And that will remove surface stains between your teeth as well over time.
Oh, look at that little nugget.
Also, just flossing daily will prevent the stains from getting there in the first place.
And the other thing is too, this might be a very naive question, but again, I'm not in your industry. That's why you're here. Flossing. Yeah. We're talking about whatever type of floss. Whether you want to use the what are they called? The plastic with the floss on it.
No, I hate those.
Oh, do tell her why.
So the floss picks, those are like the number one most loved things by all patients, and they're the number one most hated things by all dentists, because you can't properly achieve what flossing is supposed to achieve with them. When you're flossing, the goal of flossing is to remove the bacteria that's sitting under the gums, but it's high up on the curve of the tooth. So you have to go, up in between the contact and then follow the side of the tooth all the way up around, and it should go very far under the gums, as far as it goes. Most people just go in and out. They go through the contact, they're trying to get food out of their teeth, but really what makes the gums healthy is tracing that tooth surface all the way under the gum. And you can't really do that with a floss pick. You're just going to be kind of cutting your gums because you can't get that angle. It's straight. So you really need a good string floss, or a water pick will also do it, because the pressure of the water just goes naturally under the gum tissue and removes that bacteria for you.
Okay. How about going back to what you were talking about with the strips? If you were to do the strips and then, like you said, drink red wine, drink coffee, are you now almost, yes, it won't work. You're trying to say, not that it won't work. It won't work as well as doing an in-house treatment, but are you also now being counterproductive almost, or not really?
I feel like it's just negating. I feel like it just negates all the work that you're doing. So you're whitening, you're getting a little brighter, then you're restaining and you're going back. And that's what people say. They're like, oh, they don't work. I'm like, no, they don't work because you're just restaining. That's why they're not working for you. And that's what most people don't know. They don't write that on the box, of course. Like, you have to avoid coffee for 2 weeks. Like,
but it's not like it's making it worse. It's just you're totally just wasting your time, basically.
Yeah.
Okay.
You're wasting your time. With the in-office products, the number one complaint is sensitivity, because the gel is really strong and people can get a lot of tooth sensitivity from that. Sometimes it deters people from doing the in-office whitening. We, in our office, have found this like amazing, perfect little in-office whitening treatment that works super well and doesn't create sensitivity. I don't know. I didn't believe it when I first saw it. I was like, there's no way that doesn't happen. Like, you can't have both. I don't know. Somehow we get both. So we do so much whitening in our office. Like, every single day we have patients coming in for whitening. All the patients that come in for their cleaning, they stay for whitening after, because they just love this whitening product so much. And it's only 25 minutes. So that is something that we get a ton of people in, but also brides in. They come in right before their wedding and they just do that whitening treatment.
Do you have to be a patient of yours, or would you take people who are not a regular patient of yours and do the whitening?
Yeah, we have a lot of people that come in that aren't regular patients that just want to come in for the whitening. And for the most part, I'm fine with that. We do usually do a general check of their teeth before we just throw some whitening on them, because if they've got much bigger issues, I would tell them to address the issues first and then come back for whitening. Most people that are coming for whitening don't have those significant issues, so it's fine. But we do just, check that first. And I'm totally fine with seeing people for just whitening. And a lot of times they end up switching to our office if it's convenient for them, because they just like our vibe. So, yeah.
So you talked a little bit about whitening. What other cosmetic changes or procedures that you suggest people do if they want to brighten their smile?
So the second most popular treatment that we do before weddings is Invisalign. Most people think that Invisalign is like a 2-year procedure for everybody. The people that I treat in my office, the majority of them are 4 to 6 month treatment times. And so the reason for that is because a lot of the people I see are people that had braces in the past and their teeth crowded because they didn't wear the retainer. And I feel like 90% of the people in that age group are in that category because they all had braces before. And so that's why, because their bite has already been addressed by that first round of braces, all that we're really addressing is the cosmetic aspect. And there is some functional aspect to that. When the teeth are straight, they're going to function way better. Um, but it's actually a pretty simple treatment because most people just have a narrow arch. Everything has gotten narrower over time, and all that we do is we broaden everything back out and resolve the crowding. So 4 to 6 month treatment time for most people. Sometimes we go to 8 months, but usually that's when the patients aren't super compliant and it just takes a little bit longer. Um, and I feel like that is such a dramatic difference for most people. I mean, you can talk about getting veneers and all of that, but if your teeth are not straight, they're not going to look as white. It creates shadows and things. And creating this straight, broad smile and then throwing a whitening session on at the end of it is like my number one favorite treatment because it is so transformative for people. And on top of looking good, like I mentioned, straight teeth function better. When your teeth are straight, then the number one thing people tell me at the end of Invisalign is like, I never get food stuck in my teeth anymore. And it is so easy for me to brush and floss now. I'm like, yeah, because this is how they were supposed to be. There's no weird angles and edges for you to try and get into with your brush. Your toothbrush is just missing all of these areas when your teeth are all angled. And that creates inflammation, bone loss, decay, all these other problems, chipping, cracking. Then you need crowns, you need scaling root, you need all these other procedures because your teeth aren't straight. So the cosmetic aspect is really the bonus. But I mean, that's why people come in, and then I educate them about all these other benefits they're going to get by doing the treatment. And it's like a no-brainer. Um, so that's my second most popular pre-wedding treatment. And then the third would be veneers. Um, in my office, I really like to do the most non-invasive treatments that I can. So I usually recommend composite veneers for most of these young patients because I don't like to remove tooth structure to do porcelain veneers. Sometimes you can do a case of porcelain veneers without having to remove tooth structure. It depends on the shape of the patient's teeth, the position of the patient's teeth. There's a lot that goes into that decision, but most people can do composite veneers, which is a procedure where we don't remove any tooth structure, but instead we layer material over their existing tooth structure and are able to correct color, shape, length, and some positional aspects, and just create a super uniform smile that way. And it also creates a really broad smile because it's all additive over the existing tooth structure. Um, and those really tend to last a long time because the material is thick enough and it doesn't stain, which is the one of the biggest questions I get asked with the composite. Um, so yeah, I would say those are my top three.
I absolutely love those pieces of advice, and I have so many questions for you about these. So what we'll do is we're going to take a quick short break, and when we get back, we're going to dive in a little bit about that, and then I want to talk to you a little bit about stress and what that does to your smile too.
Awesome.
I appreciate you being here. And hey, if you like what you're hearing, I encourage you to check out our website at sarahzarella.com. And don't forget, you can actually subscribe to this podcast wherever you're listening so you never miss an episode. And I would so appreciate if you left a fabulous review on Apple Podcast. Even better, share it with a friend. It's a great way to show your support. And now, let's get back to the episode. Well, welcome back to Wedding Secrets Unveiled podcast, friends. Right before the break, we were talking with Dr. Goldman, and we were going over a little bit about cosmetics and what you can do to make your smile a little brighter for your wedding day. We talked a little bit about whitening the teeth, veneers, and then also we went into Invisalign. I got a question for you in regards to financials. Do you find that any of these treatments end up being covered on anybody's insurance, or how are you finding that some of these treatments are not?
So most cosmetic treatments are not covered by insurance. I have to say that dental insurance is not like medical insurance. It's not truly an insurance. You have your yearly maximum of, say, $1,000 or $2,000. So I would say it's a dental benefit, it's a dental coupon, but it is not truly insurance, and they really don't want to pay for much. Um, Definitely not cosmetic, but what they do sometimes pay for is Invisalign. Um, and what you would want to look for is whether you have an ortho benefit in your insurance plan, and you would have to make sure that it's over 18. A lot of people have an ortho benefit for patients under 18 in there, so for teenagers, but it would not apply to an adult ortho case. And usually that benefit is going to be separate from your yearly maximum. So say you have $2,000 a year to spend and you have $2,000 of ortho benefits. That's going to be a lifetime benefit. You can use it one time and it is not going to go towards your yearly maximum. I have seen cases where it does go towards the yearly maximum. So they have a lot of little rules and things that you have to look out for, but it is sometimes covered. And the most I've seen is $5,000 of coverage. I've seen it one time. So it's not many patients that have it. I would say 10 to 20% of people will actually have any insurance benefit that covers ortho, but it's worth checking for sure. And yeah, other than that, not much is covered.
And not getting into the nitty gritty of cost, but what is like the range that you would look at a whitening treatment, and also the range of that you're looking at as Invisalign? And I'm talking about like your normal turnaround time of Invisalign, not the ones that, like you said, are problematic and they don't listen.
Right. In my office, our whitening treatment is $195 a session. We also offer a 5-pack for $650, which brings it to $135 a session. And like I said, so many people like to do that whitening after their cleaning, so they get the 5-pack and they can use it whenever. However, most offices generally charge $500 to $600 for their whitening, and they're using a completely different product than what I'm using. So that is generally what you'll find out there. For Invisalign, my case average cost is $5,600, sometimes up to $6,000. That is the average cost for Invisalign in my office. If you see an orthodontist, it's probably going to be than that. But just giving you the information for my office specifically. And then for veneers, composite veneers are generally $1,600 per tooth, and porcelain, you're looking at $2,000 per tooth. So definitely getting up there in the price. The good news is we do offer financing, and I think most offices offer financing. Our financing happens to be 24 months interest-free. So most patients take advantage of that because there's no interest on it, and it helps people break down those payments.
And then for the whitening, how long does that last? So you said sometimes people get like certain packs, but what if they just did the one time, how long does that whitening for the average person that drinks the average amount of coffee and the average amount of wine and all those staining food?
I would say 6 to 12 months for the average person. And that's why people just do it with their hygiene equipment. Not every time, but sometimes every other.
Yep. All right. So question for you. What about stress? So I'm assuming, when you're planning a wedding, there's an elevated stress level. So what does that do to your smile?
So with stress often comes clenching, especially for us women who kind of hold it all in our jaw, I find. Men don't. Men just grind. They don't clench. And they don't get the headaches usually that women get. But with clenching, you get headaches. And so I do have a lot of people that come to me for Botox in their jaw just to relax the muscles. I find that when you're clenching, you often get into this tension pattern. And the tenser that the muscles get, the more likely you are to clench. And just disrupting that pattern sometimes helps to relax everything and then stop you from continuing to clench, especially if it's stress-related clenching and it's not something that's caused by not being able to breathe well or not having a good bite. If it's just related to stress, I think breaking that pattern can sometimes be enough. Um, if if it's not enough, another thing I recommend is just doing a night guard on top of the Botox to protect your teeth. The Botox will kind of weaken the muscle and prevent you from clenching as hard. But if you're still clenching, you're going to want to protect your teeth with some sort of night guard so that you're not breaking your teeth before your wedding.
All right. So, some simple questions for you. But hey, listen, it's a daily use. What is your favorite toothpaste?
I really love Crest 3D White. The only downside of that toothpaste is it is more abrasive than your typical, um, just gum health toothpaste or just like overall cavity protection toothpaste because it works, like we mentioned before, it works to remove surface stains with an abrasive. Um, I have found that personally, when I use that toothpaste, my teeth are super white. And when I stop using that toothpaste, they are not as bright. So it is working to remove the surface stain from my coffee every morning. Um, I would just kind of be wary that if you already have thin enamel, um, you probably don't want to use a whitening toothpaste. And maybe you just want to do a whitening treatment, every 6 to 12 months because you don't want to continue to wear away that enamel. And the other thing is, if you're using a whitening toothpaste, you want to be mindful of how hard you're brushing because 99% of people are brushing too hard. I'd say almost 100% of people are brushing too hard. Even I am brushing too hard. I have a toothbrush that tells me that I'm brushing too hard every morning, and I'm still brushing too hard. So, I mean, if I'm brushing too hard, I can be sure that most people are, especially if they don't have a toothbrush that's lighting up red at them when they're brushing. So, um, one thing to be, that is great to get is a toothbrush with a pressure indicator on it. My favorite one is the Oral-B IO brush, and I think Series 6 and up will have the pressure indicator light on the handle. Um, and it will also tell you if you're brushing too soft for whatever reason, but I never get that indication. It's either good or it's too hard. And I know that with my patients that have purchased that brush, they have all said that they were brushing too hard. So I think it's important so that you're not scrubbing away your enamel to at least be made aware of how hard you're brushing every day.
How does people know if they have thin enamel or losing their enamel? Something that you would tell your patient, or can they figure that out?
I do tell my patient, and one thing that people notice when their enamel is thinning is either the edge of their teeth becomes more see-through or their teeth start to look yellower because the inside of the tooth is naturally yellower than that enamel layer that's sitting over the top. And when you're whitening, you're actually whitening that middle layer, that yellow layer. It's penetrating through the enamel and whitening the center of the tooth. Um, but it's almost like the teeth start to appear more gray and translucent, and that's how you know you're losing enamel.
And can you build back an enamel, or once it's gone, it's gone?
Gone.
Okay. Things to avoid eating. I mean, obviously, we talked a little bit about coffee, but anything else, eating or drinking, people should just kind of stay away from if they want to be conscious of what their intake is.
Are you talking in terms of protecting their enamel or just in general?
Actually, I was talking in regards to whitening, but also enamel. So, I mean, I'm sure that's a two-part question. I mean, obviously, diet is the most important thing. You just want to be healthy overall, but just in terms of teeth and whitening and also your enamel.
Well, so one thing that people don't often know is if you are someone that likes to wake up in the morning, have your coffee, and then brush after, you could be brushing away your enamel that way. Coffee, because it's acidic, will start to soften your enamel as you're drinking it. And if you don't wait 30 minutes before you brush your teeth, you're probably brushing away your enamel because as the coffee softens the enamel, your saliva is trying to harden the enamel at the same time, and it will. It will if you wait 30 minutes. It will kind of negate that acidic effect of the coffee. But so many people are having the coffee, brushing their teeth, and running out the door, and they're doing damage that way. So I tell people either brush before you have your coffee or have your coffee and wait 30 minutes. And if that's not feasible, then you got to like find a way, bring a toothbrush to work or whatever it is. Same thing with orange juice, which I know not as many people have orange juice, but it's the same thing. Because it's acidic, you want to wait 30 minutes before you're brushing your teeth. So just being mindful of that. And it can happen after dinner as well. If you're having dinner and then brushing soon after, if you're having those acidic foods like tomato sauce or things like that, you just want to be mindful of the same thing. In terms of staining your teeth, one thing people don't know is like spinach and blueberries are also extremely staining. It's not just coffee and tea and red wine. Tomato sauce, spinach, and blueberries are some of the most staining foods as well.
So for a wrap-up question, because I could sit here and ask you questions all day long about making a great smile, because I got to tell you, not only do I want to personally have a good smile, but I photograph smiles. So it's really an important topic for me to cover, and I'm glad that we were able to have you on today's show. But with that said, it's time for our wrap-up question. What are some key points that couples should be asking dentists or dentists or practices when they're inquiring to make sure that they are working with a professional company and that they want to continue and maybe make the switch to go over or looking for a new dentist in general?
So the number one most important thing I'd say is to get a feel for the dentist themselves. You need, I feel like when you meet the dentist, you're gonna know whether or not you feel comfortable with them. I've had many patients come to me and say they saw another dentist and they just felt like they were rushed out the door, or the dentist didn't sit down and like look at them and talk, to them. They just gave them a treatment plan without ever even looking in their mouth, or, it was just kind of like a bad feeling that they had when they met the dentist. So I think it's really important to meet the dentist, to have a consult, and to ask any questions that you have that are on your mind, and just see how that conversation flows and see what vibe you get. And if you don't get a good vibe, then find someone that you feel really comfortable with, because you're going to invest a lot of money, and you don't want to be halfway through an Invisalign treatment and hate the dentist that you're seeing, because then you're kind of stuck to finish it out. The second thing I would say is to try to find someone that you can see some kind of before and after photo of their work, because everybody's got a different style. It's not to say that one is better than the other, but with whitening, you're just using gel. So, that it is what it is. But say with Invisalign or veneers, there's so many types of veneers out there, and some dentists really like the teeth to be all one level, and some dentists really like to have this like translucency. Some will make the teeth look super white and opaque, and some will make them look super natural. And I feel like that you have to find what you're looking for. If you want them to look a certain way, then find a dentist that makes them that way, because everybody kind of has a different style. And then other than that, I guess my last point would be to just make sure that it's going to fit within your timeline. So if you're getting married in 6 months and you go and you start an Invisalign and your treatment is 8 months, you're going to want to know that, because you're not going to be finished. And just also ask about whether or not they would be willing to take off your attachments or something like that for your wedding photos, and then put them back on if you're not quite done with treatment. Because I've definitely done that for weddings. People knew that they weren't going to be done, but they wanted their teeth to be at least better for their wedding photos, or maybe it was their baby shower, or maybe it was their wedding shower photos. We took off all of their attachments, and then they came back after that, and then we put them all back on, and we continued the treatment. So just discussing things like that to work within your timeline before your wedding, I think, is super important.
Well, I want to thank you so much for joining me on this week's episode of Wedding Secrets Unveiled. You helped our listeners become one step closer to their journey of a stress-free wedding planning. Can you tell everybody where they could find you?
Yeah, on Instagram at Dr. Naomi Goldman. And again, we practice in Peabody, Massachusetts. And website is www.levygoldmandentistry.com.
And for our listeners, I will have Dr. Goldman's information on our episode show notes, where you can find them on our blog and our website page at www.sarahzarella.com/podcast. All right. Well, thank you so much.
Thank you so much for having me.
Thank you for listening to Wedding Secrets Unveiled. I appreciate you being here. And hey, if you enjoyed this episode, I want to tell you something. I encourage you to check out our website at sarahzarella.com. We love photographing while having fun, of course. Check out our podcast page on our website for our show notes along with upcoming episodes with your local wedding experts. Listen in as we help you plan your epic event. And don't forget that you can actually subscribe to this podcast wherever you are listening so you never miss an episode. I would so appreciate if you left a review for us on Apple Podcasts. Even better, share it with a friend. It's a great way to show your support and let us know what you think. If you know any wedding experts that would like to be a guest, we have a link directly on our website where they can let us know. Thank you for listening.